Remember that road in your area that everyone complains about? At first, it was smooth, no issues, cars passed freely, people trekked without fear, and life was easy. But one day, a small pothole appeared. Nobody paid attention. Then rain fell, more cars passed, and that small pothole grew wider and deeper. Before long, the road was no longer safe. Drivers avoided it, Okadas swerved dangerously, and pedestrians had to tiptoe to avoid falling inside. That once smooth road had now become a wound in the neighborhood. This is what ulcer is inside of your body. Your stomach and intestines are normally lined with a protective road, a smooth layer called the mucosal lining. This lining shields your stomach from the harsh acid it produces to digest food. You see, stomach acid is powerful. If it touches unprotected skin, it would burn. But as long as the road is smooth and strong, the acid stays in its lane. Now here is where the trouble starts. Sometimes, due to certain reasons, that protective lining begins to wear out. Just like erosion starts breaking down a road after repeated rainfall, your stomach lining weakens. Once it thins out, the acid begins to touch the raw surface underneath, creating a sore, or what doctors call an ulcer. Think of ulcer as that deep pothole on the highway of your stomach or intestines. So what causes this erosion? A bacteria known as HP bacteria weakens the lining until acid can dig in, just like termites eating away at a wooden house. Medications, when abused, act like heavy trucks pounding on already weakened roads. Stress and poor lifestyle, excess alcohol or peppery food. So when do you know when the road is damaged? The signs are there. A burning sensation in the stomach, especially when it is empty. Pain that feels better when you eat, but comes back after a while. Bloating, nausea, and even vomiting. In serious cases, blood in stool or vomit. If a pothole is ignored, it keeps getting worse. What started as a tiny hole becomes a trench that can trap trailers. In the body, untreated ulcers can cause bleeding, perforation, or life-threatening problems. The good news is roads can be repaired and so can ulcers. Doctors use antibiotics to clear the bacteria, special drugs to reduce acid, and lifestyle changes to allow healing. Eating balanced meals on time, reducing alcohol, avoiding excessive pepper, and managing stress all help to repair the road. So here is the big takeaway. Your stomach lining is like a precious highway. Protect it. Don't allow careless habits, untreated infections, or constant heavy trucks to break it down. Because once the pothole forms, the journey becomes painful. Ulcer is not just stomach pain, it's your body telling you this road needs repair before it collapses.